Hello and welcome to an interesting edition of Health Watch, reaching you on the station for excellence NT Lagos Channel 10. You're onto the only program that gives you information and educates you on health issues affecting men, women and children. On today's edition of the program, our focus is on mental health. Yes, this is one field in one area that a lot of people have questions as regards to their mental health. And we brought you a consultant psychiatrist that will be telling you all you need to know as regards this topic. Plus, we have a segment on stress management. All this and more on this week's edition of Health Watch. My name is Nkem Okibe. We're going on a short break. When we return, you'll meet my guest. Stay with us. My name is Nkem Okibe, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by pharmacists because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervix, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it has been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch. Welcome back. If you're just joining us, the program is Health Watch, reaching you on the number one station, NT Lagos Channel 10, the station for excellence. And our focus today is on mental health. I'm always excited when our guest is a female doctor, and the person of Dr. Gbonjubola Abiri. She's a consultant psychiatrist and a mental health advocate. You're welcome to Health Watch.
Thank you very much for having me.
Yes, I know. I've been on your, I've been calling you, short notice, and I'm so glad you're on the show today. Before we go on the program, I'd like to know the meaning of your name. It's a wonderful. This is my first time hearing this name, and it sounds very wonderful.
All right. So
Okay.
my name is Gbonjubola.
Okay.
And Omo in Yoruba means child. Gbonju means coming to the knowledge or realization. And Ola means wealth.
Wow.
So basically what my name means is Omo Gbonjubola. This child has come to the knowledge or realization and has found wealth.
Wow. Gracious God, that's a beautiful name. Let's go to the focus of today's program on mental health. You know, when you mention mental health, a few people would think about, okay, mad person. And interesting to know that it cuts across a lot of things, feelings and all of that. So briefly, tell us, what does it entail, mental health?
Well, so let me commend the initiative that you've decided to speak about mental health today. And it's a great thing that is happening in the Mental Health Awareness Month of May. And so a good way to start, like you've asked, is that what is the difference between mental health and mental illness? Because most times when people hear mental health, what they're thinking is, like you said, a disheveled, unkempt looking man or woman on the street. But what we should all know and be educated about is that when we speak about health, health is a state of well-being. Okay. Not just the absence of disease or infirmity, like the WHO likes to say, but a complete state of physical, mental, and social well-being. So that's health. On the other hand, of course, illness is a debilitating state that has to do with disease, distress, and sometimes death. And so if you say that an individual is mentally healthy, it means that this individual is able to successfully perform the functions of the mind. And so the functions of the mind are the functions of thoughts, feelings, emotion, cognition, and other aspects of behavior. So that is what we refer to as mental health, a state of stability, wellness, and well-being. In psychiatry, we like to look at causation from what we know as the biological, psychological, and social aspects. And of course, each individual is looked at by their own merit. And so if you're looking at biological causation, you're looking at heredity, genetics. So certain illnesses tend to run in families. Some mental illnesses run or are found in families, or individuals are more predisposed to have them in families. So mental illnesses such as schizophrenia, depression, to mention but a few. For some, it's psychological causes. And psychology, of course, has to do with the psyche, the mind, the state of the mind. If you have issues such as, adverse childhood experiences, that means difficult things that children went through, traumatic life experiences. It could be physical trauma, sexual trauma, emotional trauma, neglect, It could even be financial, trauma as well. And so anything that affects the psyche of an individual, the self-esteem, the emotion, the confidence level, can also be a causation of mental illness. The social, of course, should be talked about, especially because we're in an environment that is difficult, tough, where there are a lot of issues with unemployment, poor financial stability, ignorance, overcrowding, poor housing and all of that. A lot of these factors are known to cause mental illnesses. But more often than not, you'd find that it's an interplay of the factors, the biological factors, the psychological factors, and the social factors mingling together to cause a mental illness.
But you agree with me that in addition to that, I think the pandemic has...
Oh yes, by all means, definitely, which is why I said, social must be spoken about. And of course, our lives in the past 18 months haven't quite exactly been the same. Everyone's life has changed in one way or the other, with COVID-19 being, the decider of quite a number of things. Life as we knew it has changed, and so we've moved from what we used to know life as to what we now know as the now normal. And of course, what has been said is that if we're not careful and if we don't attend to issues, is the fact that the next pandemic after the COVID pandemic will be a mental health pandemic. And so all hands, of course, must be on deck, like you have done today, to educate us about this issue.
I agree with that, because you see, staying at home, it's a big deal for a lot of Nigerians, especially for us in Lagos, where we used to the hustle and bustle of Lagos, and you have to be locked up in there for months. A lot of people lost their jobs. Even children are finding it difficult to cope with the online classes and all of that.
Definitely.
But thank God you are on set today. So let's talk about what are the common mental disorders?
All right, well, so when we try to look at what the common mental disorders are, again, I like to do things from an individual level. It depends on who we're talking about. Are we talking about a child, a young adult, or a full-blown adult, or even an old person? Are we talking about a male or female? Are we talking about an individual from a low socioeconomic status or from a high socioeconomic status? But be that as it may, whatever these factors that you look at are factors which are contributory to the causation of an illness, it's important that we realize that in different climes, different mental illnesses are quite common. And so in an environment like ours, and even worldwide, anxiety disorders and depressive disorders are the commonest mental health problems. In Nigeria, of course, we would like to add that substance use disorders are also quite common. Sleep disorders are common. Sexual disorders are common, even though people don't talk about them a lot. Personality disorders are also quite common. And of course, conditions like, dementias are also quite common. And so the old works, you can have the old works, and because I had also mentioned about children, you could have conditions such as pervasive developmental disorders such as autism. You can have attention deficit hyperactivity disorders. You can have conduct disorders, again, to mention but a few.
What are the symptoms that one should look out for? Like, it's very difficult for you to just see this person is not feeling well in terms of the mental aspect. But there's some symptoms that are worrisome that you should see a doctor to complain, to make that complaint that I've noticed my child doesn't come out of the sitting room. I've noticed he doesn't really talk. I don't think it's normal. I really want to know what is going on, and I can't get to speak with him.
All right, again, you probably see me smiling, and I'm wondering in my mind, so what is normal? But of course, what is normal most times, or what we judge normal by, is by what environmental standards and status is about. A few years ago when HIV came to town, what we used to say was HIV, they show for face.
True.
Sometimes you may never be able to tell that an individual has a mental health problem. And so it takes a high index of suspicion to tell whether or not this individual has, a mental health condition. So first of all, for the individual, and so it's for you and I, know yourself, know your limits, be able to, we call it self-awareness, knowing how you feel per time, knowing what triggers you, what makes you feel a certain way, what puts you in a certain mood, what makes you angry. Know yourself, if you're able to control yourself when you're angry, if you know what keeps you up late at night, or what makes you just your mind be in a place of turmoil or worry. If you're looking at it in other people, you may want to start looking at things like their behavior, their appearance, behavior from a strong deviation from what it is that you had always known. Their appearance may also change. They may start dressing flamboyantly, too extreme sometimes, or sometimes they may even pay less attention to how it is they dress. Sometimes it's the mood. You ask them how they're feeling. Sometimes you ask some people how they're feeling and they burst out crying. Some tell you, oh, I feel so great. I feel like I'm the richest man in Africa, even though you know how much this person has in their account. Sometimes it's how they look on the outside. Sometimes it's the thought system. What are they telling you? Are they telling you things like, oh, I'm tired of life. I don't want to live anymore. I feel like I'm the problem of the entire world. We call those thought disorders. For some, we call them perceptual disorders. These individuals may be having problems with perceiving things. So they may start to hear voices of people who are not there, start to see strange things that other people can't see, start to smell things, again, in any of the 5 sensory modalities. For some, depending on what kind of mental illness it is, if it's an illness that affects cognition, they may not be well oriented in time, place, or person. So for instance, people who have dementia may tell you that, oh, while it's 2 o'clock, they may tell you that, oh, we're in the middle of the night. They may tell you that they can't even remember what their names are or where they are. And again, it may be problems with memory, either immediate memory, short-term memory, or long-term memory. It may be a problem with judging normal things. And it may be a problem with not even knowing that there's a problem in the first place. We call that insight. So a lot of times when people have mental illnesses, everyone else can see that something is wrong, but the one who is affected does not see that there's something wrong. So for different people, it may take an adult to notice this in a child. It may take a spouse to notice this in a loved one. It may even take people at the workplace who see that an individual's productivity has dipped largely. However, I must add that, when people are exposed to traumatic life experiences, like loss of a job, loss of a loved one, even going through a divorce, loss of a friend, some of this, traumatic life experiences, sexual abuse, physical abuse, traumatic experiences, even as children, put people at risk of coming down with mental health disorders.
You agree with me that this topic came it's very timely at this time when we're going through a lot as a nation, even the world, the pandemic and all of that, loss of jobs. A lot of people have not been able to connect with their loved ones, as in physically, a lot of virtual meetings and all of that. But not to worry, we'll take a short break. When we return, our doctor will be telling us how to cope with mental health disorders. We'll be right back. Stay with us. Okay, the program is still Health Watch and our focus is on mental health. I've been having this lovely conversation with Gbonjubola.
Fantastic.
Gbonjubola Abiri. She's a consultant psychiatrist and a mental health advocate. And before we went on the break, there was something you talked about, the fact that every other person could see that this particular person has issues, but the person in question feels, oh, I'm okay. And the first question that came to my mind is, how do you cope with such a person? How do you manage people like that?
It can be quite difficult managing an individual who does not believe that they are ill. In fact, who thinks beyond every reasonable doubt, with all the evidence that you may put down, that they're actually ill. So relatives notice that they're talking to self, they're not sleeping well. They can see all the signs. You as a professional can see all the signs, but this person says, I am not sick. I do not need help. In fact, I'm reading a book like that at present. That's the title of the book. I am not sick. I do not need help. And it was actually, the story of someone who is really, really ill with, an illness that we call paranoid schizophrenia, but the person can't even see that they're ill. They can be quite difficult to manage. And of course, when individuals like that do not have insight, so we call that lack of an awareness to even understand that there's something wrong, to seek help, or to take the help that is offered as lack of insight. And so when lack of insight happens, it affects the individual's perception of the illness. It affects whether or not they present to the hospital. And eventually when they are presented or brought to the hospital by other people, it affects whether or not they will take care. Because they are the ones who would not believe that there's anything wrong. And of course, in the long run as well, that affects the prognosis of the illness. Because chances are they are likely to continue to be ill because they don't take any form of illness. How do we take care of this kind of people? Again, like I said, I must be honest, sometimes it can be tough. Sometimes relatives need to bring them against their will. Of course, in the most dignifying and most humane way possible. Let them trust you, bring them into the facility. Sometimes we may need to admit them, depending on the severity of the condition that they come in with. If it's a child, a child has decisions taken for them, and so the adult will take a decision on the child's behalf. However, if it's an adult, as the managing team, the head of the managing team, I'm supposed to be seen to be able to let the patient learn to trust me. and develop what most times we like to call a therapeutic alliance. The patient, believes that, well, everybody else may be wrong, but this one person may just be, trying to see what best it is that he can do for me. And so at the end of the day, what both of you would agree on is getting goals. So for me, as a therapist, my goal is that I want to return this patient back to full functioning, improved quality of life, and of course to reduce all the symptoms that we're currently seeing. To the patient, improvement to them may just be, I want to get a job. And so you tell them, see, both of us are on the same track. In fact, we use what is called the LEAP process. The LEAP is L, you listen empathetically.
Okay.
2, you show empathy. A is that you agree with them. And P, you participate in whatever it is. So you use the LEAP approach, and often more than not, you're able to, make progress with them.
Wow, fantastic to know that the way you are, your manner of approach to this kind of, what would I call it? What would I call it? Care.
Yes.
Is very it's very assuring. Like, it gives you confidence to know that you can come out of it. So just to wrap it up, is there a treatment, or is there a permanent solution to anyone who is going through any kind of mental health disorder?
Well, so, to answer that, I would probably want to put a condition like hypertension beside, and a condition like diabetes beside. And of course tell you that there are many chronic medical conditions, and the best way of management is that people will continue to use medication and do a bit of lifestyle modification. Mental health conditions are actually chronic, and they can be disabling if they are not treated early. If prompt intervention is not sought for the individual on time. And so here's what I would say. Get help. Get help first. We don't know how long you need that help for. But of course, get help for yourself or for the individual. Your doctor will be able to speak to you, your psychiatrist will be able to speak to you, or your mental health team. So that's another thing. We actually always work with a team of a psychiatrist, a clinical psychologist, an occupational therapist, mental health nurses. We work with the individual, and we encourage them as much as possible that you can live a wholesome life. Just work with the plan that the team has for you. The other thing that we do is that we listen to our patients. Again, the LEAP approach, we listen. And so we make them a part of the treatment plan. It's not that treatment is forced on the individual. The individual is an active participant in the decision-making process that is about their medication or about their, health in general. So if you are looking at, is there a cure for mental illnesses? I will tell you, no. Can mental illnesses be managed? Yes. And so, like I said to one of my patients yesterday, I wanted to give her injections, and she said, "Doctor, I don't like injections. I don't want injections." And I'm like, if we had to sit with a cancer patient, and we said to this cancer patient, what would be your one wish? The cancer patient will most likely tell you that I would have something that, would at least keep me for as long as possible. Again, dealing with mental health conditions is ensuring that the individual lives a good enough life, productive enough to ensure a very good quality of life, regardless of whatever it is that they may be dealing with.
We'll be speaking with Dr. Gbonjubola Abiri, a consultant psychiatrist and a mental health advocate. Thank you so much for coming on Health Watch. And one of the take home for everyone out there is to speak to someone.
Yes.
I believe.
Yes.
Thank you so much.
Yep.
Moving on, we have a feature on stress management. Enjoy it. We'll be right back.
With the hustle and bustle in the city today, vast majorities of people are in a state of stress. Their fast-paced lifestyle demands that they are eager to do things and are always under pressure to perform. This pressure usually leads to stress.
Stress is a feeling of physical or emotional involvement, and it actually stems from the fact that stress is something we go through on a day-to-day basis. We need a little bit of stress for us to be able to be on our toes. The psychological stress has to do with, and this usually occurs when we are getting frustrated, angry, or emotional in most cases. and that's the one that usually takes a toll on people more than the physical stress that people actually now make case for.
Stress has major effects in our day-to-day lives.
Stress can be caused by anything. Something that some people will take it as normal, some people will be stressful for normal. We all know the situation of the country, for example. When some people lost their job because of this COVID-19 pandemic, it's a stressful event. And you know, it's not going to affect the person. For example, the head of a household, a man who loses his job. I mean, it's going to be stress for him because he has to think about himself, his family, his children, his dependents. The normal symptoms we can see, people will get tired easily. Some people will feel their heart is racing. They will feel they don't have enough energy in them. They just want to sit there in one place. They start, snapping at people. Some people will go to the extent of even shouting at people, getting angry unnecessarily.
Being able to recognize common stress symptoms can help you manage them. Stress left unchecked can contribute to many health problems. Why is stress management important?
Stress management is also important because we need to know how to cool down so that people who are stressed will know how to relax, so that the bodily symptoms they feel, maybe the high blood pressure, because that's the normal thing that usually stems out first. So that once your blood pressure is controlled, once you are stressed up, you know what to do. You need to exercise, sit down, think of stressful event less, try to feel that tomorrow will be better.
Stress can have consequences far beyond temporary feeling of pressure. While you can't avoid stress, you can learn to manage it and develop skills to cope with the situations. By recognizing the symptoms of depression and the warning signs of suicide, you will be better prepared to help not only yourself but also friends.
And that's much we can take on this week's edition of Health Watch. What I want to take home for everyone out there today is, if you have any issue at all, find that person that you can talk to. It could be your friend, it could be your partner, it could just be a colleague, it could be anyone that you are free to share your personal experiences or personal issues with. Find that person. And if it gets to a point you need to talk to a doctor, please do not hesitate to talk to a doctor, because they say prevention is cheaper and better than cure. Send your mails, and you have questions, you have inquiries, you have comments, you have topics you want us to treat, then send a mail to us on kibeinkem@gmail.com or ntalagoschannel10@gmail.com, or send a text only to 07060865487. Remember that health conscious people live longer. My name is Nkem Okibi. See you next week, same time, same station. Bye.